Good morning. I'm speaking today on the traditional territory of the signatories to Treaty 7, and I'd also like to acknowledge the Métis people of Alberta who share a very deep connection with this land. I'm also joined by my colleagues, Calgary Buffalo MLA Joe Ceci and Calgary Boular-McCall MLA Irfan Sabir. Today we have new data from AHS as a result of a FOIP that our official opposition caucus did that shows just how serious the crisis is in our ambulance system here in Calgary. More and more often, there are simply no ambulances available when someone in Calgary calls 911. That situation is referred to as a red alert. And red alerts are growing more and more common across this city. And in particular, what these documents show is that in 2019, there might be a handful of red alerts each month, all of which would add up to less than an hour in any given month where an ambulance was not available. But in the past few months of this year, these documents show that there have been hundreds of red alerts in Calgary, adding up in some cases to more than 10 hours in 1 month where there was absolutely not a single ambulance available to respond to a call anywhere in Calgary. That's 10 hours each month when there are literally no ambulances available to help anyone in a city of more than 1.3 million people. Now, we've seen and heard the consequences of this, the terrible stories of Calgarians in distress waiting through unacceptable delays. And province-wide, we can see that the longest wait times are getting longer and longer. AHS aims to get 90% of calls dispatched within 90 seconds. But after years of meeting that target, we're now seeing that dispatch delays have exploded. This year, it's taking more than twice as long, almost 3 minutes or over 3 minutes, to dispatch 90% of calls. Response times for life-threatening calls are also still far above AHS targets. In Calgary, we also see that ambulances are getting stuck at overwhelmed hospitals for longer than ever. It takes 3 hours to get 90% of patients handed off to a Calgary emergency room. That's twice as long as what AHS has set as its targets. And unfortunately, what these documents today show is that this pressure is just continuing to increase in Calgary. For instance, recently we've seen that staff shortages at AHS have forced them to close the urgent care center in Airdrie overnight for 3 nights a week for the rest of the summer. And yesterday we saw that the South Calgary Urgent Care Centre had to cut its hours due to staffing shortages. So what does that mean? Well, that means that there are more people with injuries, more people with illnesses, more sick kids who are forced as a result to head off to a Calgary emergency room. And that's where we will see our ambulance and our hospital systems growing the crisis being faced by folks in this city. Now, for 7 months, Jason Copping has tried to deny that this is a crisis, tried to deny that the extent of the crisis is as much as it is. And instead, he's hidden behind an advisory committee led by 2 UCP MLAs that has offered up almost no concrete, immediate solutions. The fact is, what these documents show with a 10-fold increase is that the time to act has passed. The UCP must commit to retaining the paramedics that we currently have by guaranteeing that they can get off shift on time. They need to offer every paramedic a permanent full-time contract instead of these exploitive 89-day contracts that offer no security, no benefits, not even sick days. And the UCP must finally wake up to the incredible burden that drug poisoning crises has placed on paramedics and emergency room staff and provide local harm reduction services. Now, these are specific steps that the paramedics who run these ambulances themselves have been calling for months. No one in the UCP leadership race is talking about this crisis in any kind of serious way, and that is deeply worrying. And nobody in the UCP seems to understand that the root of this problem is this UCP government's assault on healthcare workers, especially in primary care. The UCP's attack on family doctors have left hundreds of thousands of Albertans with nowhere to go but an emergency room. So the fact is, in Calgary, we need a new approach from a new government. I promise you that an NDP government will bring real resources to the front line and restart the province's relationship with our frontline professionals. And that means that you and your family will get the care you need close to home. So thank you, and I'm happy to take any questions that you may have.
Okay, we'll start with questions in person and move to phone or questions on the line. Questions in person? Might use the mic here. Sorry.
Hi, thanks for taking. Okay, thanks for taking my question, Austin from CTD. I'm just wondering what kind of concrete action you guys would take. You mentioned that you'd like to see that from the government right now. What are maybe one or two steps that you guys would take?
Well, as I've stated, I think, you can often find the best solutions by speaking to the people who are on the front lines doing this work themselves. And so the paramedics themselves have identified at least 3 critical things that this UCP government could start with. First of all, as we look to deal with the shortage of paramedical staff, we need to move off of this 89-day exploitive temporary contract. Who's going to pick up and do that kind of job if they don't know from 3-month period to 3-month period whether they have a job? And so they should be negotiating full-time contracts with benefits and security, and they're not doing that. Secondly, what they need to be doing is ensuring that the folks who are working there can actually get off shift on time. Because, of course, by failing to give them that ability, we end up pushing more and more people out of the profession. Third, this government has to recognize that they are failing all Calgarians, all Albertans, with their very limited approach to addressing the opioid crisis in this province. The opioid crisis is a big part of these pressures, and their very singular approach to dealing with it, their unwillingness to look at the whole scope of solutions that people are suggesting out there, means that we are seeing an explosive growth in these kinds of tragedies and the pressures it puts on our whole healthcare system, and in particular on our paramedic and our ambulance system.
Just as a follow-up, from a provincial level, I'm just wondering what you think could be done to address some of the staffing challenges at healthcare centers. It's something that's going on across the country from coast to coast. So on a provincial level, what could be done to address that?
Well, I think at the end of the day, there's a few things that we have to do. First of all, we can work more closely with our post-secondary institutions to increase the number of spaces and incent people into those spaces with scholarships or training programs and that kind of thing. In addition, this is a government that who spent most of the pandemic, when we could tell these staffing pressures were there and growing, telling these people that they had to take pay cuts, and just recently finally signed off on deals that had 0% increases throughout the term of the pandemic. So they then, at a time when we have inflation at the highest we've seen in 40 years. So it's hardly a surprise that folks are going to question whether this is a line of work that they want to be in. And so the government needs to stop its attack on these frontline healthcare workers, start showing them the respect they deserve, and partnering with them on the real strategies to attract more folks into that important line of work.
Okay, we'll go to questions on the line. First question goes to Shalane Skalski.
Somewhat related to today's announcement, but focusing more on Edmonton here. I'm following up on some information we received that senior nursing staff and managers at the Royal Alex have been told to identify which patients can be safely cared for in hallways of the hospital due to overcapacity. I'm wondering, have you heard anything about this directive or these conversations, and is this concerning to you?
Well, we haven't heard directly of that yet, but we have certainly been hearing from doctors, from nurses, from many important frontline healthcare providers, that the pressures on our hospitals are growing. We know that the admissions are going back up as a result of COVID. We know that there is at the same time a shortage in healthcare personnel, and we know that there's been no specific action taken, at least publicly, by this government to address this growing problem. So, this is a crisis that we've known has been coming, and we've got a healthcare system that's in incredible disarray. We've got a temporary person leading the healthcare system right now, which only causes more chaos, and a UCP government flirting with even more destabilizing ideas, which of course is going to make the problem worse. So. There's a lot that can be done and must be done to stabilize our healthcare system and provide the kind of support and predictability to everyone who provides this important work within our healthcare on behalf of Albertans to be able to do their work confidently.
Did you follow up, Shalane?
Yeah, just kind of a follow-up to my colleague's question there in terms of what can be done to address these staff shortages. We have heard that, it's getting to the point where people want to leave the profession or leave the province altogether. You alluded in your answer about kind of renegotiating and having those conversations to stop attacking frontline workers. Does that mean an increase in pay? Is that something the NDP would do? Are we looking at paying our healthcare workers more? Is that something you would support?
We may have to. I mean, it's not a thing where we want to, sort of negotiate through the media, but I do think that we need to look at bringing folks together and looking at a human resources strategy across the board. And there's a variety of ways in which you can do that. There's different strategies you could use to attract retired workers back into the workforce. There are different strategies you can use to attract more folks into that line of work through post-secondary with more training. There's different strategies that you can do to recruit from other jurisdictions. So there's a range of tactics at disposal, and there needs to be a very clear plan developed. And we're not seeing the UCP talk about that at all. In fact, we're seeing them talk about, taking apart our healthcare system, finding new ways to privatize it, finding new ways to put people out of work, demonizing our very public servants, who are on the front lines for the work that they do. And so that kind of conversation is taking a difficult situation that, yes, exists all across the country, but then turning around and making it much, much worse, specifically right here in Alberta.
Okay, next question goes to Alana Smith.
Oh, hi there. Can you hear me okay?
Sure can.
Oh, great. So Lena Smith with the Globe and Mail. I know you just talked about how, in your opinion, the healthcare system is in disarray. You've talked about the closures in Airdrie, the reduction at the South Calgary Health Centre. I'm just wondering, how long do you think Alberta's health system, just in general, can continue like it is right now?
Well, I have to tell you that I'm very, very concerned that if Alberta's healthcare system is subjected to another 4 years of the profoundly disruptive, damaging, and sometimes outright hostile management that we have seen from the UCP, I'm not entirely convinced that it will be salvageable. So I honestly believe that this is going to be one of the critical questions that Albertans are going to have to answer as we get closer to the next election. Are we going to come together to elect a government that will genuinely work to restore our public health care system and work on fixing the many, many holes that this UCP government has dug within it, and focus on providing all Albertans with the kind of healthcare services they need, when they need it, where they need it. Albertans should know that when they pick up the phone and call an ambulance, that someone's on the other end and that there's an ambulance ready to respond to the call. And we're at a point now in Alberta's largest city where there are hours in every month where that's just simply not the case. And that's on the UCP, and that must be something they do whatever they can to fix. And right now we're not hearing a word from them about what they're going to do to make a difference in the problem that they've created.
Did you have a follow-up, Alana?
Yeah, just one. I'm just wondering if you could speak just to the disparities between rural and urban healthcare. I know we've heard a lot over many years just about the shortages and closures in rural areas, well, not as much in urban areas like we're hearing now. But what's the difference between the two places, and how would I guess you attack each problem in each area?
Well, I think in many ways we've, in some cases we've seen rural communities that had been serving as a bit of a canary in the coal mine. I remember last year, around about this time of year, being up in Grand Prairie and raising the alarm about the profound shortages that we were hearing about in our healthcare system in Grand Prairie, shortages that we were hearing about in High Prairie, shortages that we were hearing about in Fort McMurray. And from my time working in the healthcare system, I know that the farther you are outside of the urban areas, the harder it is to recruit and retain and to keep folks there when we need them. So that's why it's always important to have a strong rural retention and recruitment strategy. But what we've seen there as a chronic problem has now spread across the province in a way that is qualitatively different. It's not just quantity anymore, it's qualitatively different level of care. And we don't see the government talking about the crisis they've created or the strategy that they have to fix the problem as voters would expect them to do in the role that they have as government currently.
Next question goes to Adam Toy.
Yeah, thanks for taking my question. Just wanted to check you can hear me?
Yes, sure can.
Great. Question about the urgent care model in Alberta. 2 out of 6 service locations in the province now having reduced hours for their services. What place does urgent care have in the province, given where the system is at right now?
Well, urgent care centers are a fundamentally important tool to divert people out of our emergency rooms for urgent care that doesn't require the full scope of services that you might get in an ER. It's also a very important tool for those people who are growing in number, who cannot find a family doctor who's accessible to them on a regular basis. And so the urgent care centers are incredibly important. And to see them shutting down or reducing hours is deeply worrisome, especially when paired with the crisis that we're describing here today, which is the 10-fold increase in red alerts with respect to our ambulance services in a place like Calgary. So when you take the absence of an urgent care center and you pair it with the absence of an ambulance, what are folks supposed to do in terms of getting their emergent health conditions addressed in the way that we have come to expect and have every right to expect as citizens of this province? So these urgent care centers are critically important tools in the overall system, and yet again they demonstrate another crack in a system that this government has been actively ignoring the crisis in for pretty much since they got elected. In fact, they actually started creating the crisis even before COVID, and they've not reversed course on it. And as I say, I honestly do not believe that any part of the healthcare system in Alberta can survive another 4 years of this UCP government.
Follow up, Adam?
Yeah, getting back to the ambulances, I've spoken with some paramedics who said that this shortage of ambulances, this incidence of red alerts, even pre-pandemic, was a problem that predated the pandemic and has been going on for a good decade or even longer. Why hasn't any action been taken by previous governments, yours included?
Well, we were doing some work on the matter. So what the FOIP shows today is that there's no question it was a problem. We had red alerts before, but what this FOIP shows is that we've seen a 10 10-fold increase compared to where things were when we were last in government. But when we were in government, one of the things that we did, for instance, to address this problem was to establish the HALO program. And that was essentially extra funding that was put in place in the ERs for particular types of staff who would be there to take the patients and care for them essentially in the ER so that the ambulance drivers could leave and carry on to what was their primary job. The HALO program was discontinued and eliminated, in fact, by the UCP within the first 6 months of them taking office. So that was a strategy that had been helping. It wasn't the only strategy, and absolutely, if we were still in government and we'd seen these kinds of numbers moving, we would have long since been working very closely with frontline providers and other experts to head off the kind of crisis that we're at now. But to be clear, they reversed the piece that we had in place that we'd put in place when we were in government, and then they've stood by and watched a 10-fold increase in the problem.
Okay, next question goes to Tom Vernon.
Hi, Rachel. Thanks for taking my questions. There are going to be a couple of off-topic ones. I'm not sure if you've seen it, but the government just announced and launched a Future of Alberta Policing website. Mm-hmm. It's really pushing for provincial police service and answers a lot of questions on that front. Under the frequently asked questions, it talks about how the government firmly believes that establishing an Alberta provincial police service is not a question of if, but when. What do you make of this?
Well, I'll make a couple of comments on it, and then I will pass it over to our justice critic, Irfan Sabir. But let me just say that this is another example of a government that is ignoring the priorities of Albertans. They don't want to spend more money on a provincial police force. They don't want a provincial police force, and they want the government to be focused on things that matter to them. And so this is a government that is genuinely ignoring the interests and the clear opinion of Albertans. And is part of a longer pattern with this UCP government. But I'll pass it over to Irfan to see if he has anything more to offer. Yeah.
Thank you, Rachel. And I think if I talk specifically start from Calgary, there have been more than 77 shootings as of a couple of weeks ago. And wherever I go, including in Northeast Calgary, where the area I represent, people want this government to focus on addressing the crimes. They don't want their political gamesmanship. And when we look broadly across the province, rural municipalities of Alberta, RMA, they passed a resolution opposing this idea. Then Alberta municipalities, they passed a resolution at their fall convention, again asking government to focus on crimes and not these political games. But they're not listening to anyone. Their own report says that if we move ahead with rural Alberta provincial police force, we will lose $200 million in federal funding, and we will need $366 million in transition costs. And that's on top of what this government already downloaded onto the municipalities in their new funding model. That was $286 million that rural municipalities or Alberta municipalities are paying more in policing. So I think government should focus on crime and the root causes of crime and not these political games.
Follow up, Tom?
Yeah, it's on the UCP leadership. There's Twitter chatter. I saw Janice Irwin wade into it today about non-traditional UCP supporters, progressives, whatever, purchasing UCP memberships to avoid certain candidates winning. Have you heard much in the NDP support base doing this? And what's your message to people considering doing this?
Well, my message would simply be this. I would urge people not to do that. And let me say, I understand. It's been a tough 3 years, and people are frustrated, and they are also very worried about the future. And I also understand that we are a province that for much of the last 40 years, people felt that their only way to engage politically was to try to navigate between who was the lesser of two evils within one party. However, that's not the situation that we're in anymore. In Alberta, we have a different party It's the Alberta NDP that will do what it says, that will focus on making life more affordable for Alberta families, that will stand up for, protect and restore our public health care system, that will protect our education system, that will create long-term sustainable jobs, and that will make decisions on the basis of common sense and what Albertans tell them to do. So you don't have to choose between the lesser of two evils. You can simply sign up with the NDP and choose a better government overall.
All right, our next question goes to Graham Thompson.
Speaking of going off topic, I have a question about the bonus paid to Dr. Hinshaw. Was that valid? Was that a valid decision to give her that bonus?
You know, I want to say, I want to start by saying that the problem in this decision rests entirely with the UCP. It's not a measure of you know, Dr. Hinshaw's performance one way or the other. What I will say, though, is that there's several elements about this story that are troubling to me. First of all, at a time when this government was demanding that overworked frontline healthcare professionals who were going into work every day to support Albertans take a pay cut, it is jaw-dropping to me that they would then turn around and offer up a 60% bonus to someone who had, by her own admission, chosen not to completely exercise her authority and hand over decision-making power to an incredibly ill-informed cabinet. Secondly, I think it is absolutely unbelievable and not possible to accept as true the claim by Travis Taves that he did not know about this bonus. That's simply not true. And if it is true, then it is demonstrative of someone who has no business being finance minister in any government, and certainly not leading a government, because there's just no way that that should have happened under his watch. Finally, I will say that this whole thing smacks of the very kind of backroom deal-making that we saw lead to Albertans' rejection of the last Conservative Party. And it's in fact, it was in a response to that that our government created the Sunshine List. And it's because of that Sunshine List that we now know that this happened. But it's just not the kind of thing that I think Albertans that passes the head nod test for them. But it is not acceptable for anybody in the UCP to suggest that they didn't know about it.
And a follow-up. But what does this do to public trust in the Chief Medical Officer's office? You've got both. You got Danielle Smith attacking this bonus. You've got the AFL, Gil McGowan, attacking this bonus. And there's a lot of focus now, very much negative attention on herself and perhaps her office. So what does this do in terms of public trust in the healthcare profession, in the officials at the very top, if we hit another pandemic?
Well, I mean, I think the bigger concern here is the public trust in the people that were actually making the decisions throughout this pandemic, which of course is the UCP cabinet. So obviously we know that there are concerns around public trust, and it's very disturbing because I think that the vast majority of healthcare professionals went above and beyond and were utterly and absolutely heroic throughout this pandemic, and we all need to recognize that. I think, though, that there needs to be a consistent approach to those frontline healthcare or those healthcare professionals, and what we're seeing here is not consistent. And so, you know, pretty much everything the UCP does, every one of them, the minute they put on their shoes, tie their shoes, and walk out the door in the morning, is undermine the public trust in our healthcare system in one way or another. And this is just another example of that.
Okay, we're back to questions in person.
I just have one question off topic. How does the NDP feel about being included in the Pride Parade this year?
Well, we are incredibly honored and excited to be able to participate in Pride this year. We have a long record of trying to do everything we can to support the LGBTQ2S+ community in a variety of ways, up to and including the work that we did in government in terms of establishing GSAs across our education system and protecting the young people who are participating in them. And I will say this, that we remain committed to restoring the rights that we put in place and that the UCP undermined soon after they got elected. And in the meantime, we're just really looking forward to the opportunity to just get together with people in the community, celebrate their pride, and just to reach out and have a wonderful time with all allies and all members of the community.
Okay, one last pass for questions in person or on the line. And seeing none, that's all for today.
Thank you. Thank you much for watching, and to learn more, check out albertasfuture.ca.